It is time for a good question we got in the 7 p.m. inbox. We've been loving all the emails you've been sending to 7pm@WRAL.com. Keep it coming. Tonight's good question has to do with a major story touching thousands of people in North Carolina. The ongoing back and forth between insurance companies and healthcare providers. The one in the headlines right now is UNC Health and Cigna because the two sides have not come to an agreement. Their contract expired this week. Here's the question we got from a viewer named Dixon. He wrote, "I don't want to be in the mess that Cigna customers are in. How can I find out when insurance companies' contracts with healthcare companies renew?" That's a good question. And yes, this really is a mess for many of the 65,000 Cigna customers using UNC Health. We heard from a breast cancer survivor who had a scheduled hysterectomy today. For a minute there, it sounded like it wasn't going to happen. But after jumping through a bunch of hoops, Cigna covered it. WRAL's Sean Gallagher has been reporting on her story. I asked him about what she went through.
That got put on the books over a year ago, and then she just found out a couple of weeks before Tuesday that that was going to have to be canceled, or she would have to pay $20,000 in order to get it done, just because Cigna and UNC Health couldn't figure out this dispute.
She had to fiercely advocate for herself to get her expensive surgery covered through something called continuity of care. But talk about a stressful situation for someone who should be focusing on prepping her body for surgery and recovery. So let's get back to Dixon's question. How can I find out when insurance companies' contracts with healthcare companies renew? Right off the bat, let me just say that our major healthcare networks do list which insurance companies they contract with. We found these pages on the websites for WakeMed, Duke Health, and UNC Health. They tell you which insurance plans are accepted at their facilities, but they do not make it easy to find out when those contracts expire. So here's what we do know based on our reporting over the past few years. UNC Health reached a long-term deal with United Healthcare in March 2024. Duke Health reached a long-term deal with United a few months later. But right now, United is out of network for WakeMed. The two sides have not reached a deal, and the contract expired last month. However, WakeMed is all good with Cigna and Aetna for now. Those deals don't expire until end of next year. Duke Health is also simpatico with Aetna. They reached a deal a couple of months ago, back in October. And while we're at it, UNC, Duke, and WakeMed all have deals with Blue Cross Blue Shield. WakeMed's expires in 2027. Did you get all that? I know, it's confusing. And it's still unclear when some of those deals end. You heard the deadlines for WakeMed. I reached out to Duke Health and UNC Health. Neither could give me concrete dates. But it makes sense why these deals are difficult to make, right? I mean, think about all of the healthcare news you've been seeing over the past few years. Inflation, increased labor costs, cuts to Medicaid, tariffs on supplies, the potential swell of uninsured patients if Affordable Care Act subsidies expire. I think it's safe to assume all of these things and more are taken into account in negotiations. But we aren't in the room for those conversations. So we have to be our own advocates. Think of the woman with breast cancer who Sean Gallagher was telling us about, who almost missed her life-extending surgery. If it wasn't for her dogged efforts to get her surgery covered, threatening to take her story to the news, pushing to make sure the surgery fell under continuity of care, she may not have had that surgery at all. Tell us what you think. What part of the story are we missing? Email us 7pm@WRAL.com. What has your experience been navigating the in-network, out-of-network frustrations? And what other good questions do you have about healthcare or really anything else that's important to you? We want to hear it. Tell us what's on your mind, and we'll talk about it right here at 7 o'clock.